I'm Dr. Todd McCall. I'm a board-certified neurosurgeon. I work here in Peoria, Illinois. I've been practicing here for about 11 years now. We're here today to talk about the sacroiliac joint. So the sacroiliac joint is where the spine and pelvis intersect. Most of us know the spine, the goal of our spine is to support our body weight. And so the sacroiliac joint is where our body weight transfers from our body down to our pelvis and hips. And so it's a very important point of transition and a point that can be afflicted by arthritis because of that. The joint actually rotates around around an axis actually, so it's a fairly unique joint in that way. Importantly though, it only has a little bit of motion, a couple of degrees of motion, typically 1 to 2 degrees in men, about 2 to 4 degrees in females. So while it does have a little motion, it can still cause a lot of pain. Fortunately, because it has very little motion, if we do treat it and fuse it, the patient doesn't notice it too much clinically.
Hi, I'm Jackie, and I'm from Pekin, Illinois, and I've lived here all my life. I found out about the SI fusion from Dr. McCall because I was having a lot of lower back pain.
With regards to the sacroiliac joint, there's two main ways that it can create pain. First is just through typical degeneration or arthritis, aging, wear and tear of the joint. Also, you can have a traumatic event such as falling. Pregnancy can actually be a very traumatic event, car accidents, things like that. Typically, it's a focal pain where if I ask you where it is, you can point to it. It's not going to be a big band across the lower back. That being said though, there are nerves that run by the sacroiliac joint, so you can have nerve irritation. It can present as more of a sciatica picture where you can actually have a pain running down your thigh or even past your knee at times too. Common complaints I see for patients that have this issue is sitting in a car for a long period of time. They typically laying in bed can be painful for them, walking upstairs. And also like with any arthritic joint, typically if you put pressure on that joint, it's going to hurt, which means if you take pressure off of that joint, it's going to feel better. So people find themselves favoring that leg by putting pressure and standing on the other leg. When you see them sitting in a chair, they're going to be sitting on the other side more. Basically, taking pressure off of that joint whenever they can.
Not be in the pain of sitting for hours, like even just a few minutes would be painful for me. Or to lay down, to lift anything, to bend over, to do dishwasher, to do laundry, all those things. And that sounded really promising to me.
Statistically speaking, we think about 15 to 30% of patients with low back pain have a component of their sacroiliac joint. If you've had lumbar fusion surgery, that number is probably even higher. It's probably closer to 40%. So once we have an examination and history that are consistent with the sacroiliac joint pain, then we can start talking about treatments. Typically, we like to start with the least invasive thing possible. So first off, it would be simple things like oral medications like non-steroidal anti-inflammatories. You either have specific braces that you can use for the SI joint as well as a physical therapist. From there, any interventions are going to be more invasive, such as injections. And then if those aren't effective long-term, then we could escalate to surgery, which is obviously the most invasive.
Once Dr. McCall diagnosed me with SI joint dysfunction, that's when he proceeded to talk to me about the iFuse surgery. And it sounded very promising to me because it was a more permanent resolution.
So historically, it's a very large surgery to fuse the sacroiliac joint. Now we're very fortunate to have a minimally invasive system, which is the iFuse implant system. They have these very specific designed triangular implants now that are very good at stabilizing the SI joint, because as a triangle, it's going to prevent that rotation around a nutation of a joint. So typically we try to implant 3 of these, but again, it only takes an incision about that long to implant all 3 of them. It's a very straightforward process where we basically place a guide pin under X-ray guidance, and then we drill and then place this, each of these implants over that guide pin. Surgery normally goes very smoothly. It takes about 30 to 45 minutes in the average patient at this point. Our options as a surgeon, first of all, you want something that's minimally invasive, and then second of all, something that you know is effective. And there is only one system that meets both of those criteria, and in terms of having a large body of literature and research to show that it is actually effective.
So iFuse gave me my life back in so many ways, and that's because I can now focus on enjoying the part of my life now that I couldn't before.
We've had a lot of patients that have reached out to us after surgery and said how they have their life back and how grateful they are. And so I'd say to anybody out there that's had long-term pain that nobody's figured out and they would like somebody else to take a fresh look at them and see if we could potentially help them out, we'd be happy to see them in our office.